behalf of Access Accelerated members, on behalf of the strategic partners of Access Accelerated, City Council Challenge, NCD Alliance, PASS, World Bank, World Heart Federation, a warm welcome to our event tonight. This event, the road to 2030, forging new NCD paths based on hard-won lessons. When we started with Access Accelerated 6 years ago, that was a kind of unprecedented, innovative approach from a collective of biopharma companies, to think about a different approach on how to give a stronger response to the NCD problematic. And what we thought at that time is that without a collective response, there is very little we can do. And so we started discussing with the strategic partners to understand how to frame a collective response together. And 6 years later, I think what this initiative delivered is really incredible. So really great results, and that I think everyone can be proud of, and a warm thank you to the strategic partners. And today, we are also very proud to launch a report, a 6 years report, a lessons learned report. You will find it leaving the room upstairs with an Access Accelerated bag. Don't forget it. But of course, you can also access the report here on a web page. This report is important, not only because we discuss success achieved so far, but because also you have voices of people, patients, people representing the communities, healthcare professionals, implementers, partners, etc. They share their experience, and we will discuss that as well tonight. Lessons learned is not only to celebrate success and to discuss the lessons, it's definitely to understand how to integrate these lessons in the way forward. And we are midway to the 2030 Sustainable Development Goals. So how can we speed up? How can we make sure that we create sustainable, substantive, at-scale response to this NCD problematic, integrating NCDs into universal health coverage? This is of utmost importance. And we want to discuss with you tonight these lessons, to discuss with you the way forward. And our first speaker, our keynote speaker, is Alarcos, Cieza, unit head at WHO. A warm welcome, Alarcos. Alarcos is driving the WHO agenda on vision, hearing rehabilitation, and disability. She is part of the NCD department. And your field of expertise is on measurement of health, policy development, and implementation. That's important, strategic planning. And you are passionate about equity and human rights. So how to make sure that equity and human rights are embedded into our UHC and NCD response, and what is the road to 2030?
Great. Thank you, Martin. And I think you can hear me?
Yes.
Yeah. And look, what I would like to do, and I was very happy to see that the music has stopped, because I would like to start with a minute of silence. And this minute of silence was for the 28 people that has died of cancer, cardiovascular disease, diabetes, pulmonary diseases, mental health conditions in this minute. 25 from them are in low and middle income countries. We know also that only because of tobacco consume and unhealthy diet, 16 million people die every year due to non-communicable diseases. WHO launched 2 weeks ago the World Health Statistics report. And in this report we say that still 22% of the world population consume tobacco. We also report that since the 1970s, the prevalence of obesity and hypertension has steadily increased. And there is no single sign that this will decrease over the years to come. And look, the question that we have at the NCD department at WHO is, how can this be? And how can this be, especially in an area of health that has it all? It has it all for being a political priority. Look, first we have a common road with a common destination. We have a target, 3.4, where member states have committed to reduce mortality by 1/3 by 2030. Second, there is political commitment and momentum. Look, we are on the way to the fourth high-level meeting on NCDs. And this year alone, WHO is convening the ministerial meeting of small island development states, and is gathering the head of states for NCDs at the UN General Assembly. Thirdly, we know exactly what works. And we know what works at policy level, at clinical level. We know what needs to be done to strengthen health systems, and we have the tools. Actually, now at the side event of the World Health Assembly, but also tomorrow, member states will discuss and endorse a menu of political choices and interventions that are cost-effective, and that we know that work. Fourthly, we know what is at stake. We know how to measure. We know how to monitor it. We have the targets also for single diseases. Every country can look at the WHO webpage and see what is the prevalence of non-communicable diseases, what is the prevalence of the risk factors, and what are the trends. And the fifth point that really speaks for really NCDs having it all in terms of political priority is that NCDs has the actor power. There is an absolutely amazing advocacy at the global level, at the grassroots level. Also, the field of NCDs has committed, or is committed, and engaging more and more people living with NCDs to hear about their experiences and also to really listen to them and motivate them to be the engines of change. And you have organizations like the World Bank and the World Health Organization that are committed to this cause. So even really the actor power is there. So going back to these 28 deaths per minute, how can it be? And of course at WHO and at the NCD department, we don't want to pretend that there is a single answer or an easy answer to this question. But what it seems to be very clear is that not everyone is on the same road. And some actors are potentially on the same road, but going into the opposite direction, as it is the tobacco industry and important components of the nutrition industry. For other actors like the pharmaceutical industry, we have signs that even if not on the same road, at least the directions are aligned. And the access accelerated is one of those signs. And actually this week also at the World Health Assembly we have had other signs. And for example, yesterday there was an amazing site event where the CDC member states, the CDC Africa member states, and also the pharmaceutical industry came together to really commit to local manufacturing of insulin for the whole Africa continent. So it is exciting to have this meeting today to really look at what the pharmaceutical industry has really make possible and reflect on the lessons learned, but also to look to the future directions. And we really would like to see that you continue being aligned in the direction, and hopefully that you are also targeting to the same destination. That would be the wish. So I really look forward to the discussions, and it's a great pleasure to be here with you today, representing the NCD department at WHO. So thank you.
Thank you so much, Alarcos, for this call for further public-private partnership, and definitely we seek for more alignment on that. And thank you also for recalling that we know what to do, that the momentum is there, so let's do it. And what we can share is also the lessons on how we could progress over the last 6 years. And I welcome Takanori Sato to discuss these lessons with you. Taka is the Director of Global Public Affairs at Takeda. Takeda is a member of Access Accelerated, and Taka is also Vice Chair of the Board of Access Accelerated. He has more than 30 years experience in the pharma industry, and I think that your key focus, Taka, is on public-private partnership. So floor is yours.
Marta, thank you very much for your introduction. So I'm Taka Sato of Global Public Affairs of Takeda Pharmaceutical Company, and as well as Vice Chair of Access Accelerated Steering Committee. And good evening, respected guests and esteemed partners and friends. With great pleasure, we gather this evening to discuss lessons learned and the way forward to strengthen the NCD response. The Access Accelerated and partnered 6-year report here, this key lessons in advancing access to NCD care is an important milestone. It emerges at a pivotal moment. We stand at the halfway point of the implementation of the UN Sustainable Development Goals and the conclusion of Phase 1 and Phase 2 of Access Accelerated. Over the past 6 years, since it was first created, Access Accelerated, along with our strategic partners, we see some of them. So here, City Cancer Challenge, NCD Alliance, PASS, World Bank, and the World Heart Federation has been strongly committed to addressing the rising NCD challenge. In 2022 alone, 54 Access Accelerated supported projects reached over 700 million people in 37 countries. Over 21 million individuals were screened for NCD risk factors. More than 11 million were diagnosed, and over 3.5 million received treatment. Over the last 3 years, 13 projects achieved national scale transitioning from pilot programs to locally embedded projects. Our partners' projects have influenced policy across 35 countries, affecting lasting legacies. From this partnership, we gained valuable insights and 5 essential lessons. First, openness, transparency, measurement, communication in partnership are non-negotiable. These principles build trust, promote coordinated and coherent action, foster knowledge creation and exchange, and helps to pull multi-stakeholder efforts towards the common shared vision. Second, flexible, non-competing, and long-term funding is vital to develop solutions that are embedded within the community and responsive to its unique needs. Flexible funding has enabled accelerated partner projects the freedom to address multiple needs, test solutions, and promote creativity that is essential for innovation. Third, another key lesson is the imperative to lean into innovative, integrated, and system-level approach to address broader health goals and strengthen health systems. Through adopting a more integrated approach, NCD programming not only creates the impact for people living with NCD, but it can also advance us towards global health goals, including universal health coverage and strong primary care. Fourth, what we have also learned is that community and patient-centric approach is the key. Designing and developing projects with patients and community needs at their core ensures quality and sustainability. Fifth, and finally, we must all agree that meaningful change requires time and long-term commitment, and shift and decisive action is important. But patience, persistence, and a long-term perspective is equally essential to achieve sustainable, scalable change when it comes to addressing NCD. As an NCD health development community, we have opportunity to leverage these insights and accelerate progress towards the global NCD and health target. On behalf of Access Accelerated members, we extend our thanks and praise to our partners for their invaluable contributions, expertise, and collaboration over the past 6 years that accumulated in these critical learnings and insights. Thank you.
Thank you so much, Taka. Important lessons. And please take time to read them in the report afterwards. There is, I think, food for thought. I invite now Monique Vledder and Lilian Mbau for the Women's Leadership Fireside Chat. And the Fireside Chat is going to be chaired by Sumitra Krishnamurti.
Can everyone hear me fine?
Yes.
Thank you, Martha. That was a very kind introduction. And I am very happy to be moderating this Fireside Chat event. Today's topic will be on the role of creativity. We don't often put creativity and NCDs together. And if we think about creativity as turning new and imaginative ideas into life, this really is the story of Access Accelerated. And several of the lessons that Taka pointed to actually tie into creativity. For example, Access Accelerated was creative in bringing about new stakeholders into NCD action, namely the private sector through the biopharmaceutical industry. Access Accelerated was also creative in bringing different stakeholders to get together and align under one common shared goal, but also to openly and transparently communicate with one another along the way. And Access Accelerated also gave us an answer to financing challenges, which enabled a move from pilot initiatives into what are now nationally owned large-scale programs. And so with that, to help us disentangle this further, we have two leaders in the field, Monique Vledder and Lilian Mbau. And I will just quickly introduce them both. Dr. Monique Vledder represents the World Bank. She is the practice manager for the Global Health, Nutrition and Population Unit. And Monique is passionate about innovative and smart investments to improve women's, children's, and adolescent health. And she brings with her 25 years of experience working, again, across various different global regions. And Dr. Lilian Mbau, she's the CEO of the Kenya Cardiac Society. which is a local partner to the World Heart Federation, another strategic partner of Access Accelerated. And she is a medical doctor, a public health practitioner, and a preventive cardiology specialist. And she has extensive knowledge when it comes to managing large-scale NCD programs in resource-constrained settings. So to get us going, the first question I want to talk about relates to creativity in relation to where we're at right now in the run-up to 2030 and the SDGs. We're a little bit over halfway through the SDGs, and right now is an important stake moment, and we're realizing that we need new and innovative approaches to address key challenges in NCDs, but also when it comes to development more broadly. And so, Monique and Lilian, I want to ask you, with this in mind, how important is creativity to you, and how important do you think it is to address key challenges that we're seeing? And if you're able to also tell me a little bit more about how your organizations joined the Access Accelerated. Lilian, why don't we start with you?
All right. Thank you so much, and thank you for the organizers for inviting me for this forum. I'm very privileged. So maybe just to give a bit of context about Kenya. So about half of the hospital admissions are due to cardiovascular diseases. And 1 in 4 Kenyans have hypertension. And we have about 50 cardiologists for a population of 50 million people. And obviously, like other low and middle income countries, we are still struggling with the communicable diseases. So we have a double burden, actually triple: communicable, non-communicable, and maternal and child health challenges. And already there is a shrinked budget for health. So then we throw in NCDs. So you can now see the kind of situation we are working with. So as Kenya Cardiac Society, we are really grateful to World Heart Federation. They have been working with us to see how to address the rising burden of CVDs, cardiovascular diseases in Kenya. And when this program started, we had just developed our first national guidelines for management of cardiovascular conditions. And this was unique because actually across the region, I think Kenya is one of the few countries which has an actual guideline. And our guideline is not just a clinical guideline, it's actually a policy document because it actually gives the roadmap on how the country can address CVDs. So for us as a society, we were very excited when Access program came in and the support from WHF to help us roll out this plan or implement this policy. But as I said, this is in the background of all the challenges, the limited budget, constrained health workforce. So there are few health workers and they have to already manage this communicable diseases. So creativity we could not run away from creativity. We had to look at where do we start, what is already on the ground. So for me, creativity is looking at what is available on the ground, which is the best starting point. And for you to get this, you need to consult and work with the local actors, ourselves, and now go down to so in Kenya we have the national government and county governments. So we had to actually even consult the county governments and see what is available on the ground and which would be the starting points that would give us the biggest results. So we did not go with ready-made solutions. Yes, we had an idea of what we wanted to do, but we had to really consult the health leaders and health workers and then come up with a program that would work for them. So for us, that's how we used creativity.
That's really great. Thank you, Lilian. And what are your thoughts, Monique, on this?
Right, thank you. First of all, I'd like to thank Access Accelerated for organizing this event and also for everybody to participate at the end of a very long day. It's great to see such a big group interested in this topic, and I'm delighted to be here, particularly also because for us at the World Bank, the AA partnership has been really instrumental to make a shift in the way we look at the integration of NCDs in our health system programs. And I want to talk a little bit about that, and it relates to the creativity, which in my view is my interpretation of creativity is the innovation piece, right? And so when I think it was 2016, 2017, when we started this partnership, and it provided funding, and you would say, okay, you're at the World Bank, the World Bank is a bank, there's a lot of funding available, and yes, there's a lot of funding available, and that goes directly to countries, but there's actually not that much funding that we can use in a flexible way to take some risk, to say, okay, we have a problem here that is maybe fairly new to countries, and I think Lilian explained it so clearly. A lot of countries in Africa are struggling with this triple burden, right? And so how do you integrate NCDs in this local context? And the funding that AA provided us with the opportunity to work with our client countries and really look at, here we have some flexible funding. There's not really a lot at risk here. We could try something different. And the results, I came into this job 6 months ago. I had the luxury of having, my desk full with all these examples of the country work, the regional work, the global work that had been financed through this initiative. And it's just been an incredibly rich experience. And so I'll give just a flavor of some of the examples, right? A lot of the countries looked at sort of a diagnostic, so sort of building the evidence base. When you have good data, and then you can go into a conversation with Ministry of Health or Finance and really say, hey, are we not missing something here? We see this big burden. We see that this cascade of care, we're actually not reaching the right people. Certain people are excluded. They are not compliant to their therapies that are necessary, etc. Which was having that data was a really good entry point to have those conversations, and oftentimes that actually led them to World Bank health projects financing the follow-up and the scale-up of those recommendations. But there were also opportunities to look regionally. They have a different benefit. And so in Eastern Europe, for example, there were connections between countries in terms of the challenges that they were facing to address NCDs. And so it's by bringing that together on the one header and one study, really looking at what's happening in Eastern Europe and what needs to be done. It was an opportunity for cross-country learning, and with that flexibility and the creativity, there was a lot of exchange between those countries to really use the results of that research. And maybe just to mention on global level, there are various examples. One of them really stood out to me. One of my team members said, this is a gift that continues giving, and that is a database that helps us to understand how we can use taxation in the case of sugar-sweetened beverages. I practice saying that. I find it very difficult words to say in English, but SSB to say it. And actually look it up. It's really interesting. And it's been a great learning opportunities for other countries to go down that same road. And so I think now 55% of the world population lives in countries that have taxation for SSBs.
Great, thank you so much. That was brilliant, and I appreciate the reflections on creativity. I hope we can continue to keep this in mind as we continue our discussion. My second question is related to success. And I want us here to take a little bit of a moment and think about loads of different factors that have to come together to really enable successful NCD actions. And I guess we had a particularly important success factor being reliable, flexible, and long-term funding from Access Accelerated. And so what I want to ask you next, Monique and Lilian, is what are some elements of success to you? And from your perspective, do you think we need to redefine what success means when it comes to NCDs? Why don't we start with you, Lily?
Yeah, I think for me, success is defined differently depending on what level. So maybe at the Access global level, they may define success different from our health workers in the village. So for our health workers in the village, maybe this program, through the program, they're able to get blood pressure machines in their clinics. And that sounds like a very low level achievement, but actually for them that's huge. So I think to define success, we need to look at what level. And I think as we design programs, I think before we determine what success is, I think we need to first establish what is the need on the ground, co-create the solution, implement it, and then based on what we have co-created, then we can talk about success factors. But if you come with the metrics already defined, when you go to the ground, sometimes what you're planning to do is totally different. Like for us, we had planned to train health workers on guidelines, but then we went there and found, in addition to capacity gaps, they did not have diagnostic equipment for like echo and ECG. So we had to quickly then include training for echo and ECG, and we had to move the funds around. So if we had just defined success as training by itself, you see we'll miss out on other success parameters. So I think the success factors should be defined after we are already clear on the needs on the ground, consult the different stakeholders, then together agree what is success for us. That's my view. And then the other success factor for me, which I found is, I think if you can get the local actors to put resources into the program. So for us, we found that, yes, they want echo training, but we told them, okay, then can you get the echo machines? And so they were able now to go and see how to budget for echo machines. So then there's buy-in and there's ownership. So I think if you can get the local actors to commit resources into whatever you're doing, for me that's also a proxy for success, because there's ownership and likely sustainability.
Please, Monique, go ahead.
It's a great answer. So it's about people, right? If everything we do collectively doesn't touch people's life, what's the point, right? And so it's really important we keep that very, very laser sharp focus on who we are reaching and how, and what is the outcome of that. And so for me, what's next is, how do we bring some of these experiences that have been so rich and hugely variable and so much opportunity in the learning that took place to something that is at scale, right? And so we want to move away from sort of a phase in which we say we are pushing the boundaries, we're piloting, we're looking at small scale to at national level. What do national governments, what should national governments be funding? How should they organize their services, their primary care services? How should they finance them under really, really, really constrained economic circumstances to have the highest impact? And in the countries we work with in Latin America or in Eastern Europe, the choices are pretty clear. In Africa, it's challenging. If you have to make decisions between your maternal deaths are going up, infectious disease outbreaks are happening more because of climate change, and then on top of that you have an increasing burden in NCD. Where do you put your weight? And so for us at the World Bank, we have a very large portfolio of health system investments, and so when we work with countries, we fund the public health function, we fund primary healthcare reforms as well as the financing reforms, and we want to make sure that in that next phase in those national programs that we have in over 100 countries, that we have fully mainstreamed the knowledge and the experience we have now on what needs to happen on the NCD agenda.
Thank you. That makes a lot of sense to me, and it sounds like from both of your perspectives, it really comes down to making sure we listen to local realities and local actors to shape these environments of change. And I guess, Monique, with that in mind, my next question is for you. And you mentioned many points, but what about ensuring that projects become locally embedded? What advice would you give to organizations, to people that are hoping that their projects become locally relevant and sustainable over time? How do we get this right?
Yeah, so there's nobody who cares more about the functioning and the impact of the health system as the national governments and the representatives in country. And so we cannot sit in Geneva or in Washington and make decisions around what needs to be. This is highly contextual and dependent on so many factors that are driven by country realities. And so, of course, we need to see across all of the different countries that we work in that certain elements are there. We need to have strong community-based primary healthcare services. We need to finance comprehensive package of services. We cannot go in a vertical way and say we only care about this disease or that disease or the other. No, we need to have a comprehensive approach to how we finance and strengthen the supply chain, the HRH, etc. But in the end, if it's not driven by local priorities and local leadership, we will not be impactful.
Thank you, Monique. That was really, really great. And I guess I'm curious now to hear from you, Lilian, because being on the ground requires different creativity to see project embeddedness through, right, and this implementation. And so I'm wondering if you could tell us more about how you were able to engage your decision makers on the ground and inspire them to really think about frontline workers. And again, if you have any advice for organizations and people who are hoping to help achieve sustainable projects.
Yeah, just to add on the previous question, I still want to emphasize that if for embeddedness, I think we need to get the national governments, both at national and local level, to actually invest in those projects. I think for us, once they do that, whatever level, it may not even be monetary, sometimes it's in kind, but that gesture of them allocating whatever resources are towards the program will definitely lead to embeddedness, because it means they invested. So I think for me that's critical. The other thing we did was we actually used the health workers to advocate themselves to the leaders, because they are the ones who are in the facility without drugs, without blood pressure machines. So we actually, when we went to different forums with them, we now encourage them that they are the ones who actually now need to go and also lobby and push their local leaders to increase their support. And we've seen a lot of we saw a lot of them reaching out to them. Some of them got sponsorship to go for training, like the eco training. So some of them were actually able to get their own county governments to sponsor them for training. So I think using the local, those who are on the ground to participate in talking to their leaders, I think has been a useful approach.
Thank you. That makes a lot of sense to me. And now I guess I want to talk about what happens next and thinking about the future. And I'm wondering, Monique and Lilian, how would you see your reflections from today's conversation really influencing how we approach NCD action tomorrow? Could you share maybe one or two ideas on how we can take these ideas up to the global level moving forward?
Yeah, so I can share what we are working on at the World Bank, as we're looking at a global health strategy and how we engage on country level, and partly because the changes that we see in disease profile, like aging and NCDs, but also because of the impact that climate has on health systems outcomes and on patient outcomes. And so we're looking at a portfolio of programs we have. We have $34 billion in active health system programs at the moment, over 100 countries, 230 projects. And we see that as an opportunity to really, in a transformative way, shift the way we do financing, taking into consideration the learning we've done in the last 6 years around the importance of NCDs and the various different ways in which we have learned we can address NCDs in the broader health system context. And we talked earlier about scale, and so the importance is really that Saccharin transformation we can make to ensure that all of our health system investments have a component in there looking at integration of NCDs in primary healthcare, in data measurement, etc.
And Lilian, can I ask you to try to be concise?
Okay.
I understand we have a few minutes.
So I think for me, I'm convinced that we can't make headway if our governments don't put funding towards NCDs. So we need, and we are going to continue requiring our own governments to support NCDs because there is no funding coming, or if there is, it's not enough. So for us in our countries, it's just to see how to get our governments to invest in NCDs. And as I said, if we are doing any programs, even if they are funded, let's see how we can ask them also to put their own funding into those programs so that there is that local ownership. Yeah.
Great. Thank you, Lilian, and thank you, Monique. We will open this up to questions from the audience in just a minute, but before we do that, I have one last question for you both, and that's about how you would describe the future of access to NCD care in just a few words. From hearing you speak today, for me, I think it's about daring to be bold in your requests for governments. If you had to summarize the future of access to NCD care, how would you go about this in just a few words? Lilian, you seem thoughtful. Let's start with you.
I don't know why resilience comes to my head, because I think it'll take a lot for us to, go against all odds, all the challenges, and convince our governments to invest in NCD. So we need to, that sustained effort for me is how I would summarize for us in our setting, sustained effort to push the NCD agenda.
What about you, Monique?
It's related commitment, I would say.
Great. That makes a lot of sense, and that was really great. Thank you both. I guess now we have some time for some questions. We have 5 minutes. If we can please start by introducing yourselves, your affiliation, and who the question is addressed to, that would be great. Thank you.
Thank you. Vinay Prasad, I head the Tobacco Control Program in WHO, and thanks to Alarcos for flagging that 8 million people out of the 16 you mentioned tobacco causes premature death. And also you heard Dr. Tedros in his opening plenary 2 days ago about the FCTC and things moving forward. But still 22% of the world has tobacco. So while we are very innovative in reaching out to a lot of patients, let's use the word patients loosely here, the addicts, and we have those technologies, we have innovation, we are patient-centric. But unless until we shape the market, the ecosystem, we will not be able to get the best fruits out of it. So for example, in tobacco, we've recently set up a tobacco consortium with Dr. Tedros launched during the sidelines of the World Health Summit, which allows pharma, digital, health systems, all of them to work together, the private sector to work together. So and it's still early days, but we are trying to experiment with that. And it's very important to look at how you shape that market at the country level. Otherwise, we'll have the innovation, we will have patient-centric, piloted evidence, but it will not scale.
Thank you. That was great. Monique, do you want to take this question on how to scale up effectively?
I think it's a really important comment that the service delivery part of it and the behavioral part and demand side part, are we reaching the right people, is only one element, right? And so for other elements, we need different approaches. And we discussed a little bit before the panel started on the importance of having these tax control approaches that have been really quite effective in many places. So I'm delighted to hear WHO is also working so strongly, even with some bank economists also on it. So hopefully that will be very impactful.
Lilian, do you also want to comment on this?
Yeah, maybe just to agree that apart from, yes, the patient-facing activities, of course, the industry factors have to be looked at.
Definitely. Please, here in the front.
Hi, I'm Dr. Niti Paul. I work with my colleagues here from AXA, the insurance company, on inclusive insurance. So my question to you is on NCDs and inclusive insurance and financing of NCDs. A lot of insurers won't fund it because of pre-existing conditions. So question to you, I think, on what is World Bank thinking about how you actually finance through insurance and other means, NCDs. I don't know whether it's in your report. I haven't seen it yet.
Yeah, that's a very long side discussion, but maybe afterwards, but a really important topic in terms of what we call strategic purchasing, right? And so initially it starts with sort of a government free access to a comprehensive package of services, and then when the financing system becomes more sophisticated, we look at insurance programs, etc. And so it's very, very complex. We do a lot of work in this area, and I'd love to have a side conversation with you on that.
Thanks, Monique. Any additional questions? Yes, lady in red.
I'm Dr. Rosa Maria Rios from Women in Global Health. I'm very happy to see on the floor 3 women, so inspiring. I want to do a different approach about your conversation. Maybe if we create a safety psychological workplace, we can develop creativity. We can develop training and and success, and also we can pushing a little status quo to be successful.
Great comment. Thank you. Do either of you want to comment on this? So I think the idea was to try to be a little bit innovative in our approach, right? To
Create psychosocial, and that is important in the workplace, that is working with the health worker in a safety psychological workplace. That will help. This will be help to be more innovative and to be more success, because the workplace is safe, you know.
Yeah, it's a very interesting angle, and I think psychologically safe workplaces really improve motivation and performance of people, and so that also applies to health workers. So I love that idea. I think it's a great point.
Yeah, I think I totally agree. I think one of our challenges is motivation of health workers, especially those who work in the remote areas. You know, they have really sacrificed a lot. Amenities are not there, so they struggle a lot, you know, with remaining motivated. So I think those are very important things to look at.
and the gentleman over here at the corner.
Thank you very much. My name is Hassan Mohammed. I'm from the Maldives. I'm head of the Uncommunicable Disease Division. Yeah, thank you very much actually for all the inputs, the experience, specifically from the Kenyan perspective. A lot of we have heard on the care to patient, access to care, but you did mention about SSBs. I just want to share that in our case, we have the social health insurance that covers everything for everyone. And that's a huge investment from the government. And I'm going to say that it's not going to be sustained, because unless we are able to control the upstream, the risk factors, access to care and looking after the patients, we will not win the battle unless we are able to control from the upstream the risk factors. And unfortunately, as Dr. Vinayak just mentioned, the partnerships in some of the risk factors for like tobacco use, unfortunately we can't have a public-private partnership. And this is going to be a big challenge, and I hope you can shed some light on this area of prevention. Thank you.
Great question. Please, Dr. Lilian, do you have anything to say on this?
I just want to agree. And I know I talked about guidelines, and when people hear guidelines, they just think of clinical, you know, treatment. But actually, for us, our guideline is cross-cutting all the way from prevention. So what we did for the health workers, when we trained them, we actually focused about they themselves changing their behavior. And we had a lot of health workers who reported that they had actually adopted healthy behaviors. They had lost weight, controlled their lipids, because we believe by starting with the health worker as well and getting them to accept the role of prevention, then they can translate that to the patient. So I totally agree, and as a country, it's one of the areas we need to prioritize, because we won't be able to afford all the escalating burden of CBDs.
Monique, do you have anything to add?
I'm just really happy that you raised the issue of prevention. It's so important. We see the escalating costs of the health system, but it's also in circumstances where the pressure on the budget because of the economic situation and interest payment for debt, etc., is really, really high. And so it's not gotten easier to find the funding for all of the priorities. So another reason also to look more seriously at prevention, as it really it prevents the escalating cost as well as having better impact for patients.
Thank you both. Any other questions from the audience? Okay, burning questions coming up now.
Lots of questions. So hello everyone, I'm Safia Chansel, currently representing the International Pharmaceutical Federation. I'm the Early Career Pharmaceutical Group President. I was hoping to hear your thoughts as pharmacists, community pharmacists to specify, are the most accessible healthcare providers, and how do you envision the involvement of pharmacists in combating and preventing the NCDs? I was hoping to hear your thoughts. Thank you.
Great question. an actor we don't usually think about, but definitely important in the field. Lilian, do you want to take this on first, and then we go to Monique?
Well, I think we were chatting earlier, and I said, I think in Kenya we really underutilize pharmacies. Actually, honestly, in the care pathway, they don't actually, appear strongly. And I know in other countries they are used to educate patients on the medication, all that. It doesn't happen in Kenya. So it's a big gap. Most of the pharmacists actually work in the retail outlets, and many of them go into industry. So I think that's an area, as a country, we need to look at, because it's a wasted human resource. So yeah, I totally agree.
Great, thank you. And Monique, what are your thoughts?
Yeah, I agree. It's a great idea. I don't think it happens a lot in the projects that we finance, and there's probably a huge opportunity there. So thanks for raising it.
Thank you. We'll take this as the last question.
Thank you very much. I'm Dr. Jordi Serna-Pons. I'm very involved in the discussion of space and governments, but also now with a group of doctors, we have created something called Planet Health Innovation Network, digital and also planetary health. No? It's clear the relationship between livestock, NCDs, and planet health. So the same thing we are preventing for human body, what should prevent with the earth. No? The issue of the tax sugar in Hungary, paying then doctors. No? You know that in Hungary they are collecting taxes to the beverages, and then they're paying doctors more. Are there not any potential links between, obviously, prevention in healthcare, prevention for the planet, because it's a must, no? It's a mandatory thing?
Great question, and I think a burning topic that is coming up increasingly when it comes to NCDs. So, Monique, maybe we can start off with you on this question.
But then you're also saying that the taxes that you raise, you link it then to making investments back into the health sector. Yeah, exactly. Yeah, I think it's great. And I think actually many countries are doing, I wouldn't have an overview of how many countries are doing it, but I do know anecdotally that many countries are doing that. And I mean, there's a huge health benefits in doing the taxes, but we also need to be cautious that we need other financing strategies as well, because the amount of funding that you raise is very modest for the actual needs, and so that remains a challenge.
Yeah, I think for Kenya, it's there is taxation of tobacco products, and I think what we need to strengthen is the channeling of those funds. So many times, yes, they are being taxed, but many times the taxes are not really being directed towards health in a big way. So I think that's an area we need to work on as a country, and even tax things like sugar sweetened beverages, which is not happening. But I think we have plans in place to work on those.
Great. So I think this brings us to the end of our fireside chat. I want to thank Monique and Lilian for being so generous with your time and your ideas, and I hope that this was also inspiring for you in the audience. And now I want you to accompany me in saying thanks with a round of applause.